Today is buyout. It's going to be very, very busy. I think we have 2 trailer loads of horses coming in, and these horses are hopefully in better condition than what we have seen. Like that donkey is still totally heartbreaking. But if you didn't see that, you can watch it in one of the previous episodes. But yeah, our team is here, and we are excited and ready to roll and help as many horses as we can today. And
I don't know if y'all know this or not, but we're rescuing 25 horses is the plan today. 25, that's a lot of horses.
We'll see.
We'll see who all shows up.
A lot of times people are like, but you were gonna rescue this many or that many. We don't know for sure how many horses get on the trailer. Like, it's a buyout. We're not going to like an auction today and we're gonna get this many horses. Even when you go to auctions, you don't know how many horses are going to be there. So the goal is 25. We'll see what happens by the end of the day.
But I do know the first trailer is almost here.
It's
Our
on
vet
its
team
way.
is getting all set up.
There's 11 horses on the first load from what I understand. But first, we wanted to talk a little bit about a disease because it's sweeping the nation in the news right now. So Dr. Lydia and I are going to talk about that.
Yeah, let me go find Dr. Lydia.
He's going to go get ready to get these horses in here. We know that there's a massive outbreak of disease, and we've been saying it, like we've been posting and releasing from our investigation, that there's a huge amount of disease within the horse slaughter pipeline, and our worries were that it was going to be affecting the horse population, what that would look like. And if you check the news, it's everywhere right now.
I want to quantify that just a little tiny bit. So we have been working to identify bacteria that we have seen in horses with respiratory disease that come into Horse Plus. What we know from studying different types of diseases is that there are certain conditions that exacerbate the likelihood that your horse gets sick. And travel is one of them. Intermingling with new groups is one of them. Those things are just kind of inherently stressful to horses. So the equine herpes virus outbreak that you may have read about if you're a horse owner is something very specific, and it's a viral disease. So that's different a little bit from what Tawny's talking about that we've documented. Viral disease is very common in colder months. But what we know about that outbreak is that there have been quite a few, I don't know the exact amount, but like in the teens, quite a few cases of equine herpes virus myelencephalopathy or myelencephalitis. That is from EHV1. And I've actually had a bunch of different people go, I need to vaccinate my horse. So I just wanted to talk really quickly about what EHV1 is, the diseases, the symptoms that it can cause in horses, and then kind of what to do about it, what signs we would see. And I'm going to keep it brief because it's a buyout day.
Yeah, it is buyout. We have horses on their way. With the heavy amount of antibiotic usage within the slaughter pipeline, could this affect this disease?
That's a great, thank you for bringing up antibiotics. So antibiotics do not kill viruses at all. Sometimes we employ them if we suspect a secondary bacterial infection is present, but not only do antibiotics not kill viruses, they can kill off the good bacteria in your body, your normal flora, which can actually negatively affect your immune system if you don't actually need them and make it worse. So that's why having a doctor prescribe a medication. Medications are prescription only if people go, hey, you actually have to know what the disease is in order to treat it appropriately. And so that's why we have to be really careful using antibiotics.
And so why are we doing a buyout when there's a disease outbreak happening?
So one of the things that I love about Horse Plus is that we prioritize evidence-based care here. A big part of that is, almost without exception, horses that show up at Horse Plus get a veterinary exam within the first hour or two of arrival. Sometimes it's a couple days. Sometimes if an animal is really dangerous or very, very sick and we can see obviously from afar, there's more wiggle room there. But so that we have a veterinarian on staff here. We also have an amazing partnership with the Cord Diagnostic Laboratory in Nashville. Shout out to Cord, they're amazing. They do diagnostic tests for a subsidized cost and sometimes even free for us. So instead of, as a nonprofit, having to go, can I spend $189 to do a culture and sensitivity on this bacteria, or a PCR, a chain reaction test to see if a virus is present. That lab supports what we do, and they do those tests free for us at Horse Plus. So instead of worrying that we might be bringing horses in that might have been affected, we already do a lot of the biosecurity things that I'll talk about in a second related to equine herpes virus, but also we have a full quarantine facility. So we are very fortunate here at Horse Plus to have a really big facility and space. And red is our quarantine color, green is our general population color. We don't ever bring horses in and just dump them into general population. And you've heard us talk about our staff. It looks like I'm wearing regular clothes today, but you'll see us wear masks and gloves later on. And I actually have a change of clothes in my bag. So we kind of do a scrub in, scrub out. We do biosecurity measures by disinfecting our boots. We have boot covers. So we already have protocols in place to minimize the risk of disease spreading.
Have we ever had this disease here at Horse Plus before?
We've had multiple cases of equine herpes virus, but there are a bunch of different strains of equine herpes virus. So the current outbreak is of EHV1. You want me to talk about it?
Yeah.
Okay. So EHV1 can cause 4 different potential clinical signs. The most common one, I believe, and I'm not a viral expert, but is respiratory disease. It can cause abortion, it can cause death in very young foals, and it can cause the myelencephalitis, which causes neurologic disease. That strain affects the central nervous system, so the brain and spinal cord. It affects the blood vessels in that area. So it's a very serious disease. It's often a fatal disease. But more commonly, we would see the respiratory disease. And if you've watched Horse Plus's videos, we have a lot of horses coughing, fevers, lethargy, nasal discharge, weakness. Those are the signs of EHV1 myelencephalopathy. Fever is that hallmark first one. So I looked it up this morning just to see what the current recommendations were for those horses that were exposed, or, say you went to a rodeo in Oklahoma or Texas in November and you don't know if your horse was exposed. The earliest sign that we would see would be a pretty significant fever. So the current recommendation is to check temperatures in horses twice a day for the first 21 days. And if your horse isn't microchipped, Horse Plus uses these Home Again temp scan microchips. They're relatively inexpensive. We buy them in bulk.
Well, yeah, for us they're like $5 a chip, but if you go to a veterinarian, it will be under $100 to have it implanted, and they can just scan it and get the temperature.
It's so easy. Literally, you don't even have to touch the horse and beep it. So that's really nice for us. We can monitor horses with these temp scans. We also do have EHV protection as a part of our core vaccination strategy. So we use a vaccine called Prestige 5 plus West Nile virus. Confusingly, the labeling on that vaccine says rhinopneumonitis. So if you're looking at your bottle of vaccine or your horse's medical record and you're panicking because you don't see EHV 1 or 4, the labeling against these herpes viruses often under rhinopneumonitis, and you can look it up under that. Like Merck makes a vaccine that we use. You can look it up on the Merck website, or you can contact your veterinarian. However, the testing for that vaccine is to target the respiratory version, the respiratory signs, and it hasn't been tested or proven to prevent the reproductive problems that we see with these viruses or the central nervous system signs. So while it is great and not a bad idea to vaccinate your horse against these core things, if your horse has been vaccinated using one of these vaccines that helps target EHV, it might reduce the risk, but it will not prevent infection necessarily if your horse is exposed. So the most important thing is biosecurity. Transmission is usually direct, but it can also be indirect. So the 2 direct forms that herpes virus and also a lot of bacterial respiratory disease are nose-to-nose contact. Your horse smells the nose of another horse, or aerosolized droplets. So if your horse coughs, sneezes, or just is breathing hard and they're shedding those viral or bacterial particles, those can go into the air, and another horse coming around the ring, breathes that air. So those are direct routes. That is the greatest risk. But then indirect routes can be people. It could be your sweatshirt. Your horse rubs their snot on your sweatshirt, or those respiratory particles land on you, or they're on your boots. They could be on implements that you're using to clean your trailer. They can be on brushes. They can stay on tack. They can stay in stalls and on trailers. Not nearly as long as some other viruses that we see. So the main concern is that direct contact route. But washing your hands and practicing good biosecurity is
Disinfect everything.
always a good way to go. 10% bleach kills most things, both bacterial and viral, but it doesn't work in the presence of organic matter. So if you're not sure, and especially if you think your horse might have been exposed, just contact your veterinarian and ask them what their recommendations are. But that's a good
one last question
overview.
I've seen, does Horse Plus report the diseases that come in, like diphtheria? Is the CDC really involved with that?
Yeah, absolutely. In fact, the way our government is set up, our first diphtheria case, I actually got called by the Department of Public Health before I even had the result. So yes, Horse Plus is very proactive. Dr. Beatty is our Tennessee State veterinarian. She's wonderful. She's probably tired of hearing from us, so we email her a lot. Yes, there are certain diseases that are reportable in certain states. That's not the same across every state. But there's also wording, if you look at those the regulations, that are just like a significant respiratory disease of unknown origin. You know, if you suspect a trend or you see something that seems way sicker than it should be, tell your state vet. And so we work really hard to do that at Horse Plus, and Dr. Beatty has been very involved. Certainly if there's anything as significant as diphtheria or EHV, but strangles is a disease that's not reportable in the state of Tennessee. It's reportable in a bunch of other states. And I let Dr. Beatty know if we have a strangles case, just so it's on her radar, just so she's aware.
So we report everything, and these diseases are rampant within the horse slaughter pipeline. Like strangles is everywhere. So, our push right now is to educate about the disease factor within the horse slaughter pipeline, because we don't want it to affect the horses out there that are living amazing lives with their owners and doing all these things. So I think the horses are just about here for our buyout, and we'll be rescuing them and doing everything that.
Sorry, I try to keep it brief. I could talk about.
She talks a long time.
Biosecurity.
She talks a long time.
A lot.
A long time. It's one of her favorite topics. But we just want to do a little bit to educate you all about what's happening here and why Horse Plus is not shutting down, and we're still here for horses, even throughout breakouts like.
And this one back here is blind, at least in the right eye. Hi. Okay, friends. I'm going to try to just see if this horse will back. Good job. Good job. Whoop. Good job. Awesome. Maybe you want to pull that one into a separate spot. Hi, little chestnut. I'm so happy nobody's down. Are you also vision impaired? Hang on a second. This horse may also be vision impaired.
I think so. It literally just ran into the trailer.
Yeah, this horse is also completely blind. Okay. Oh, that horse is just covered in very bloated ticks. Oh boy. So not ideal, and also a potential disease vector, right? Because ticks fall off molt and then bite another animal.
Come on. There you go.
Guys.
There you go. Come on. Oh, they look so good. They're like, they have some weight
Everything
to them.
can walk.
Okay, it looks like we got donkeys and mules, so
Left hind limb lameness on the
let's divide it off and have donkeys and mules. Look at the donkeys.
Oh, hi, babies. Hey, look, your feet aren't in the worst shape we've
donkey.
ever seen. That's great.
Cute little donkers, come on.
Hi, friends.
Oh, your feet are messed up, huh? Come on, you'll be fine.
Oh, I'm so happy that nothing is like.
Come on. Come on.
Here you go, guys.
Come on.
I'll get you some water in just a second,
You got this.
okay?
Come on. You can do it. There you go.
Hang on a second. He is really not, can we keep him on, let's keep him on the,
I was gonna say, I've got all the red buckets back there, Jason, too, for the water.
he has some pretty severe slipper toes. So if you look at his front feet, they're curved all the way up. So that's one of those hallmark signs of laminitis. He's also walking, trying to keep weight off his front feet, which is another sign of laminitis. Yeah, you can see he's in pretty rough shape.
No, you're right. You're right. Easy.
Okay, heart rate is upper 50s. Good boy. So Trey, I'm just gonna sedate him a little bit so we can take some x-rays of his feet. Thank you for helping us. Boy. Can you hold his head up? Yeah, just regular head up is perfect. Good boy. Oh, goodness. Yeah. Yeah, he might try to lay down. He's got a lot of pain in these front feet. If we can get him over here, great. And if not, we can take x-rays right here. Yes. Sydney, there's a big horse over here that's got left hind is super duper duper swollen. It's the biggest horse in this group, kind of the
Probably
light
the one
bay.
that sticks out, yeah.
Yes, if you can possibly get hands on that horse, that would be great. Probably need some pain meds. We can take Brad's right here if we need to. Oh, good job, team. Thank you. So we're gonna take some x-rays of this poor little guy's feet. Yes, I'm sorry, I forgot. Wooden block. On you, so this helps us measure radiation. Hey, sweet boy.
So what is this wooden block for?
So I need to get an x-ray that shows me where the bone inside that hoof is. And if the foot is on the ground, I can't actually see that part of the body accurately. So we're gonna use this to elevate the hoof off the ground just a little bit. Good boy. Yeah, severe chronic. I'm trying to get my R in there. I don't know that we need to take the other one. That's diagnostic. So what we see from this x-ray, and you can see from the outside too. So this hoof wall is very abnormal, but see how this bone goes up like this? It's called the slipper toe. It's supposed to go straight down and over. So the actual angle of this bone would be measured here. And that angle is supposed to be parallel to this angle, like perfectly parallel. So should be like this and is actually like this. So that's severe rotation. Wolff's law is the law in science, and it says that bone remodels in response to the pressures put on it. So when we have a bone that has so severely changed its shape and put on more extra bone where bone shouldn't be, that's an indication of chronic disease process. So this poor little guy's been foundering probably for years and years. To bring up, so Lulu is a little mule who came in last month and her feet looked about this bad, but when we took x-rays, she didn't have rotation. So this is the critical determination of whether or not we can help them. And I probably shouldn't, but I watch a lot of animal rescue videos, and you see animals whose feet are in horrific shape and then they have positive success stories. And the key is you have to do the diagnostic. There is nothing in the world that can fix this guy's bones. He is painful every step that he takes, and he's been painful. But if his bone inside hadn't rotated, absolutely, we would do exactly what we did with Lulu, where we would fix those feet today, put him on some pain meds. Lulu's doing really great. So thank you, Tawny, for bringing that up. The diagnostic is the critical point to determining how to move forward.
Prior to us having our own x-ray machine on site, we would do our rescue mission days, and we would see stuff like this. And as most rescuers that don't have x-rays, we would try to fix it. We're like, oh yeah, we can fix it and everything. And then months later, there's still lameness, there's still all these issues. And then we'd pay a bunch of money to have the x-ray machine brought here to do a bunch of x-rays. And then we would find out, oh, this horse or this donkey has all these issues. And now, because of the digital x-ray machine, we're able to figure out what the problem is before making the treatment plan. And prior to that, it was like, here's the problem, let's try this. And it was for animals that had like rotation like him, it prolongs suffering when you're trying to fix something and the animal's suffering and there's no outcome that's positive. So x-ray is extremely important, and we're so blessed to have our own x-ray machine here. It takes a lot of money and saving and budgeting, but having it here helps animals so much in situations like this.
Can you go a tiny bit faster? I'm sorry I'm being so bossy. Perfect, thank you. Oh, sorry, Justin.
You're good.
Almost ran right into you. Thank you so much, Trey. That's perfect.
So when they're walking, what are you looking for?
A lot of different things, but primarily I am gauging the pattern of where the feet are landing, and for any swinging out or paddling or any lameness. This horse is obviously off on that left hind, but doesn't seem to be painfully off. So I'm also gauging the horse's mental state as they're walking. Okay. Yes. Easy. Yeah, you can't see through that door, right? Easy. That's okay. Okay, great. Heart rate is normal. Good job. And I'm actually kind of happy to see a scar there. So diagnostic that we need, but that takes a good bit longer. So our goal for today is just to make sure that these horses get what they need in terms of pain control and can safely undergo our quarantine period. And so far, I'm happy with how that looks. And by the way, if you're watching this, some things I can't do without being able to feel with my hands, things like extra heat. So if you watch me do this, we are supposed to wear gloves, and we do take that very seriously. But I, at some point in the exam, take my gloves off because I can't feel what I need to feel without it. That last little donkey had digital pulses that I couldn't feel through my gloves. And so I'm not being disrespectful of our biosecurity protocols. I'm just doing my job. Yeah, you're a good boy. No, you're worried. It's okay. Easy. You gotta be respectful. Good boy. Good boy. Easy. Good job. Okay. We'll give that just a minute.
So what are you filling out here?
So for each horse, this is our intake form, and I don't remember things if I don't write them down. So for each horse, as I do a physical exam and find things out about them, I record it on their sheet. And then if there are things that we need to get done, like this horse needs left hind radiographs plus or minus an ultrasound, I'm gonna write it down on there. Good boy. Good boy. Kind of like a first prelim look. So I trust your judgment. What do you think about clippers? Have you experienced these before? You want to see it? Good boy. Trey, will you just let me know if he seems reactive? Good boy. Good boy. Oof, this is a big leg.
So when you're feeling around, what are you feeling for exactly?
I am feeling for heat, pitting edema, areas that are moist that shouldn't be moist, and just kind of generally, you don't ever want to kind of like blindly clip. So he's got scarring here, here, here. And on the medial side of the leg. Okay, I'm gonna see if he'll let me clip it just a little bit. See you reactive to that at all, Trey? Great, okay.
He's saying pink elephants.
Pink elephants. First two were my top two, like.
There's one with diesel deal there.
Okay. This horse actually is very stable. Like pain-wise, his heart rate is normal. All right, I gotta change my settings real quick. And then can we take one more? I cut off kind of the front part of this foot. Beautiful.
So you took the x-rays of on top and
Yes.
everything. How's everything looking?
So I am seeing some evidence of mild arthritis, but nothing remarkable in the back. We're gonna have Dr. Marina review these radiographs. But most importantly, this horse seems to be comfortable today. So that's the most significant formation of arthritis on the outsides of these bones. So he definitely has something going on, but it all looks kind of like old and stable to me. So at Horse Plus, we don't, he doesn't have to be rideable to be valuable to us as an equid. He just has to be comfortable and to be able to be a horse. So I'm happy so far with how these things look. So we're gonna go ahead and, look what he's doing with his lips. We're gonna deworm him and microchip him. Hi. You good boy. Well, he's about 18 or 19. Good boy. put him down as 19 and put him down for a dental, but a non-urgent dental. Thank you.
So what are all of these vaccines and
This
whatnot?
is a dewormer. I don't recommend that private horse owners routinely deworm their horses anymore. I do fecal egg counts. But with these guys with unknown medical histories, and with the volume of horses that come in one day, so we have 21 scheduled to come in today, we can't do fecal egg counts on all of them just due to staff time. So we deworm everybody because we don't want them to pose a risk to others by shedding worms. I know you don't like the pokes, and I'm sorry. Let me just drop my stuff.
You want EquiSpot on anybody?
Yes, please. I think if we can, mostly on the legs, this is bot fly season. So that's gonna help keep us from having to deworm.
You want to explain what bot flies are?
Sure. Bot flies are a little, they almost kind of look like a wasp that kind of hovers, but they lay, actually this horse has bot fly eggs. They lay these eggs on the horse, and see how they're kind of concentrated towards the front? So then this horse would itch or lick and swallow these eggs, and then they hatch out and they become gastrointestinal parasites. So if you see these on your horse, remove the eggs, but also might need to take a poop sample into your vet to make sure your horse doesn't have strongyles or strongyloides. They're usually pretty hard to kill, but we have a lot of resistant parasites these days, so I always encourage people to find out what parasites you're dealing with before you treat for them, because your treatment could be totally ineffective.
And what is that little
This
thing
stuff
putting
is
on?
called EquiSpot. I really like this product. I use a similar product on my own horses. It lasts for about 2 weeks. So it's November here in Tennessee. We're kind of past the main insect season, but we do on warm days still have flies out, and we can't catch these horses and bring them in and fly spray them on a daily basis. That's unrealistic for us as a rescue. So this product helps us.
So essentially it's like a fly spray type
Correct.
thing.
Long-acting external parasiticide. So it doesn't look like a thoroughbred, but I should check for a tattoo just to be sure. No ID found. All right, big harpoon. Good boy. So you gotta go fast.
So what are GI sounds?
What's that?
What are
GI sounds?
Yeah.
But GI sounds,
Yeah.
gastrointestinal, we always want to listen on 4 quadrants and take note of the sounds in all 4 of those quadrants. It gives us a good idea on whether the gastrointestinal tract is moving too fast or too slow or not moving at all. And in this horse so far, they all sound normal. Sydney, would you mind walking back out and let's just walk him down and up? Yeah. Okay, he's got really upright pasterns. That's good, Sydney. Thank you. You can pull him in. It looks to me like he's got really upright pasterns, like kind of poor conformation in the back, and so that joint probably just pops out, but he looks stable. Heart rate of 44. We've got an arrhythmia and a grade 2 out of 6 murmur. Sydney, can you get him to step up with this leg, just 1 step? Good boy, perfect.
Look at your mustache. It's very dignified.
I'm not finished with my exam yet.
I must ask you a question.
You have some hard teeth to aid you by, my friend. Because this side looks like 12. And this side looks like 16. I guess we're going to go with 16. You're so skinny. Need some groceries. Yeah, I think that's gonna curry right off. Should I pretend like I need back radiographs to generate a medical reason? No, let's do all the things.
Pen over here. Let's keep so. Yeah, and then we need to get the other blind.
Little bag, I don't know if it's still there. Nope, the other one.
Cheer up, bud.
It doesn't look.
I'm gonna get your heart rate okay. I didn't have any treats for right now. You looking at things? You good girl. I know. You can be grumpy. That's okay. You gotta listen, okay? Girl. You gonna be really grumpy? Okay. I'll sedate you a little bit. We gotta look at you a lot more closely. That is probably a standard bred tattoo. And Trey, I'm gonna poke her over here.
Yeah, be careful. I got it. You're good.
Good girl. We'll let that kick in and then I'll finish my exam. Standard bred, yeah.
So what are you looking for? What are you seeing?
I just started an exam on this little mare, and both of these horses are blind, so we're gonna move over so they don't have to work around each other. I am gonna evaluate this horse's whole body, but right off the bat, it looks like she's got ringworm, which is a fungal skin infection. She's got some nasal discharge. She has a very poor body condition. She does have a cut tail tendon, and notably, once it's already happened, this doesn't cause pain, or we wouldn't do it. But see how this tail just flips all the way over without any resistance? So this is actually the spine, and when they transect those tendons, sometimes they cause serious damage to the spine. And I have been informed that it's not just the big lick industry that does this, it's also other gaited horse industries. This is the horse that was covered in ticks. That's very disgusting. Just gonna go ahead and pull that one off. This mare is blind in both eyes. She doesn't look like her eyes are super painful, but she is holding them closed a lot, which can be an indication of discomfort. Do you want to see what she's like in there? Because we just need this front leg. So if we don't need sedation, great. But if we do need sedation, happy to do that. Doesn't know that that's just a pole on the ground. So she anticipates maybe having to step up. So I would call that a component of a well-adjusted horse's behavior to being blind. Equispot on her because she seems really irritated by flies. Hi, big girl. Let's get those flies off of that leg, okay? Good job. Good girl. Oh, I wasted some Equispot. Oh, I wasted a lot of Equispot. This is why you don't let the vet do these things. Got it. It's my squeaky shoes, just so the blind horses can hear where I am. I can't tell if that is mud or not. Let's take one more and then we might need to do a little grooming. You're a good girl. I'm right in front of you, okay? Good job. Oh, you drooled on my head. I felt it. Looks like a...
Straight to the bone, but
All right.
not the joint.
I'm gonna sedate her and clip that and look at it better.
Very well behaved.
Yeah, she's a good girl. Tennessee walking horse, she's got a cut tail tendon. Great.
So what exactly is this right here?
That is betadine. It is a little bit old school. My kind of only complaint about it is that it looks a lot like blood. So owners kind of freak out. Like, is that blood? It is just kind of has a nice spectrum of antimicrobial activity, and it's relatively gentle on tissue. So I'm using it to clean up this little skin wound. That's actually well on its way to healing. There was a scab over it with some infection. So
that just kind of prevents any like...
it reduces the amount of bacteria present. It doesn't eliminate the bacteria, but if your white blood cells are fighting against the bad guys, the fewer the bad guys there are, the easier it is for your body to heal them.
What's that goo right there?
I love this product. This was donated to us probably a year ago, and it is amazing. Prior to using this, I would have said that there really isn't a whole lot of hope for treating proud flesh, which is just excessive granulation tissue in horses with topical products, but the stuff is amazing. Nicole contacted the company to ask what was in it, and they were like, we can't tell you. So whatever it is, it works. It's amazing.
If it works, it works.
Yes. Do you remember donated and we have a ton of ivermectin that expires in April?
For UHB.
We're gonna go with 20. I want a nasal swab.
Do you want this? You might have to just hold.
This donkey smells like cows or goats. Hey. Oh, you're so cute. Whoop, whoop. I need you to stay over here. Okay. Good boy. I'm just checking to see if your feet hurt, okay?
What do pulses mean?
Digital pulses, the best explanation that I have heard to understand them is if you've ever slammed your thumb in your car door and you feel that like boom, boom pain, the hoof is a relatively inflexible capsule. So if you have inflammation in the vasculature of the foot, you can't necessarily appreciate it in the hoof itself, but you can feel it above that. It's an indication that there's inflammation in the foot, and in donkeys, the most common cause is laminitis. So we need some foot radiographs. I think, can you pick this up for me? What a good boy! Wow, I did not think that was gonna happen like that.
I'm gonna come from the front.
Okay. Whoa. Good boy. You're a good boy. Oh, sorry. All right, I don't see rotation though. I don't necessarily need the orthogonal. I don't love this gas tract right there, coming up the front. Can we take the other foot? Yep. Would be great. Oh, good job. Someone's really worked with this guy. Can you step down? Not sure if he can. Oops, sorry. There's some remodeling on that one.
And that one's rotated.
Yeah. Not the worst I've seen though. Can we take a dental radiograph? I don't know how to age this guy. I actually can like barely palpate Galvani's groove, which would put him like he's somewhere in his 20s.
Yeah. Okay.
Between 22 and 29. Is that a bullet?
Looks like it.
Like a shotgun, bird shot.
It looks like a, okay.
Take it up his leg further and see if there's more.
You didn't
Always
like
when we
hang
found
off.
There's
more.
Spreads out.
I'm gonna wait for you to get lined up.
Yeah. Sydney, he's not sedated. He's been really good, but we don't want to hurt equipment. I'm gonna try like right here.
Are you going this way?
I'm just going this way. Marina's gonna be like, what did you do? We're gonna say we did the best we could.
was the bullet?
It looks like it's right on the side.
So it was lower down.
It's lower. It's like, looks like it's here.
Lower. I know one horse we took pictures of, and like all by its withers, it just all bullets.
Yeah, we can take one higher.
No wonder he has so many problems. People are shooting his legs.
What are you trying to get now?
It's just to find out if that's the only one or if there's more.
No, where?
I'm gonna go kind of like here, just to see if there's any more.
So sad. Oh, I can't reach that.
I'll take what you give me. Nope.
You want me to go on the other side and push it?
In the X-ray, so somebody had shot this.
That's what you're getting.
Okay, I'll take it.
No.
Don't see anything else.
Okay, do you want any other x-rays before I take this out?
I don't think so. I think for completeness, we could look at the other carpus, but I really see pretty minimal arthritis. Come on, guys. Easy. Don't make each other slip, please. Easy. Got edema under that jaw. Is that your mom? Oh. This one might be vision impaired? Yeah. I think this one can't see. And also looks maybe neurologic. Whoa, that eye needs to come out. Easy. Are either one of those studs?
I don't think so.
Okay. Because I can close this, but it feels like there's not space for... Hi, friends. Hi.
This horse might have an abscess on its This horse came off the last trailer, and its eyeball is really swollen. So the horse has pretty bad ground manners, but if you can imagine pressure and your head throbbing from the pain, you know, you might not stand still either. So they're just getting through the donkeys, and then he's the next one, most critical from this latest group.
Okay, let's not run people over. Don't smash Tani, please. I'll just sedate him a little bit. Yes. Calling everyone a boy today. I have no idea if this is a gelding or not.
He looks like a
He does. Good boy. Good job. Okay. Yep. We are a gelding. Wow. That's a big eyeball.
You love doing eyeball surgery.
I love doing eyeball surgeries. I sure do. Okay, let's not run Tani over. All right, sweet boy. You're doing great. Good job. Okay, he's got a little bit of a heart murmur. Not the worst one I've ever heard. It's a 3.
Oh boy.
He's so old.
Look at them old man teeth.
He's so old.
Yeah. Need some dental radiographs on you, my friend.
Look at his little incisors.
Oh, wow.
Yeah. Let's take some dental rats on you.
Mountain horse, and those are
Beautiful.
I know there's hay in there, but.
And not over here. I'm sorry about the mud. If you look at this horse's eyes, that this left eye has increased pressure when compared to the right. So you can see how big this eye is, and it's kind of just oozing tears. So that is hallmark for glaucoma, which can cause pretty severe pain and discomfort. So this horse needs an emergency enucleation, but he also has a heart murmur, and he has really no occlusal surfaces to speak of, and likely would need almost all of his teeth pulled, even to possibly try to feed him mash. So super sweet, gorgeous boy. This is my favorite horse color. I've never had a liver chestnut, but this horse deserved to have whoever loved him and cared for him say goodbye to him at home. He did not deserve to get dumped in the slaughter pipeline in his 30s. Just don't do that to your older horse. I'm recommending the last act of kindness. He had some great pain meds, and I'm glad that he's not going to continue suffering.
Hi. You got some nasal discharge.
Some old abscess blowout on that foot.
So what are the main concerns with this horse?
This horse, I noted on getting off the trailer, is pretty uneven in the hind end. I think it's this left hind, and there's some atrophy associated with that. It looks like this horse has had some chronic issues with abscessation. That looks like an old ruptured abscess. I don't know why somebody clipped you. Yeah. Hi, sweet old thing. You got cataract, and we got some nasal discharge. Trey, do you mind walking this horse up and down for me so I can watch him or her walk? I did not note him.
Everybody's a boy.
So far, we've had a lot more geldings than. Oh, he's off on both of the hind legs. See how that left hind just kind of like collapsed when he tried to turn? What is hanging off the side of your leg right here? What is that? You have such a cute face. What is that? Cockleburrs.
Oh, gnats.
So how does this hoof come like that?
He ruptured an abscess out right there. Yeah, I think he's got white line disease and he's scraping. It looks like he's wearing the toe.
Yeah.
I think that's just his.
All four like that.
You good boy. I think that's just his foot. Yeah, he just has really bad white line disease. Are you maybe a little neurologic? You know how it's just loud and kind of all the time? And down here, same?
Yeah, I hear it.
Yeah.
Yeah.
What is he listening to?
So this horse has hyperperistalsis, which is just a fancy word for saying food is moving through the small intestine way more quickly than it should. Peristalsis is when the small intestine kind of like moves along like this. And hyper means fast or more than. So this horse has some diarrhea and some evidence of diarrhea staining on his legs. And when you listen to his gut sounds, they're gurgling really quickly. I find that's often linked to dental disease in older horses. This guy is also lame on both hind legs, which is why it's hard to tell which one. I think the left hind is worse than the right hind, but he's got atrophy on both legs. He has atrophy on this side up here, but then lower down, he has atrophy on this side, and then his hock is swollen on this side. So he's got a lot going on. I'm gonna get some more things to pull some blood, and we'll keep going.
So we hear the word Cushing's a lot. What does that mean?
Yeah, Cushing's is the layman's term for a disease called hyperadrenocorticism. It means, super oversimplification, that your body has too high levels of cortisol. There is a medication called Pergolide that is very effective at reducing that hormone. And so when we catch it early, it's something that we can pretty easily keep horses in remission with. But when they get to later stages of the disease, their bodies aren't able to compensate as well. And when you have high levels of cortisol, if you've heard of that hormone, it can cause a lot of other problems with chronic inflammation and a lot of other stuff. It is one of the things that we can test partially for here at Horse Plus. We can do an ACTH, an adrenocorticotropin releasing hormone panel here at Horse Plus. So some types of Cushing's won't show up on that one panel, but usually that's your mainstay, and it's something we can do here. It takes about 20 minutes. So we're gonna run some blood work on this guy and see, and also take some x-rays of his teeth. Hey, oh my goodness. Oh yeah, I'm gonna go get some pain meds. I'll be right back.
Close.
We're gonna take some x-rays of your teeth. I'm sorry. Okay. All
right, no, I can't, he's in his 30s, like somewhere. Just, buddy. All right. I might just have to sedate him. I need a nasal swab and I need a better. Scar over nose. Okay. Mare. Oh, there we go. I'm not sure what happened there. Not a lot of teeth left. Let's take one a little bit further down. Can I get a DP too? Why are these images so bad? Can you try that one again? This is the same setting I always use. What's going on over there? Got major.
That's cool.
Look at that, yeah.
Or the
We've got a lot going on associated with these tooth roots. This one, oh, it's a furcation. See how you can see the little root of this tooth coming up over? And then all of these tooth roots down here are abnormal. This is not a great radiograph because of movement. But this horse won't let me examine his mouth. Maybe he will now that he's sedated. I also don't like the opacity changes in the mandible right here. So this doesn't appear normal to me. And we're gonna have our radiologist, Dr. Marina, take a look at this. His incisors are worn kind of past the level of the soft palate. So he's not able to effectively apprehend and rip the grass off anymore. But then in the back, he has 2 teeth that appear to be fractured, and he has multiple teeth that have furcations, which just means the little U part at the bottom of a tooth that shows kind of where the tooth roots are is actually up above the gums. And when I palpate inside his mouth, I can actually move those teeth with my fingers. And then he also has some diastema, which is abnormal spacing between the teeth. When that happens, we can have food packing up in there. But also, poor guy, he has some ulcers on his gums on this side, and then on the x-ray, the opacity of his mandible looks weird. So what that means is his jawbone, when we look at the x-ray, the bone should have a predictable density, and the density of the bone of his jaw right here is way lighter than it should be. So if you've heard of women getting osteoporosis when they age, that's one condition that can cause the opacity of that bone to change. So I'm not saying this horse has osteoporosis, but he does have something significant going on with his mandible that appears to be causing him discomfort because he doesn't want us to touch it at all. He did get some good pain medication. He is lame in both of his hind legs, more significantly in the left hind leg, but because he's lame in both of them, it's a little bit hard to tell how severe it is because he's compensating. You know, he's lame on both of those. He is not neurologic. He passed his proprioceptive placing. He's just very guarded because he's got pain back there. Overall, this poor guy, he just has pain on both the front and back end of his body. And I am going to run some blood work on him to see if he has Cushing's disease as well, which we talked about a little earlier, but I don't think I can fix his teeth. I don't have any confidence that I can get him comfortable, and the kindest thing to do is to let him go. Hi, Hi, sweet girl. I know you can't see well over here. You're okay. I think this horse also had ringworm, so watch out on the muzzle. You good girl. Good job. Good girl. Okay, I know. Good girl. Oh, that ulcer is awful. Melting corneal ulcer, and I don't want to cause her any discomfort. This mare has had pain medication. But what you see is a circle in the middle of a really cloudy cornea. See the circle right there? Yeah. So that means that, I'm sorry, girl. The ulcer has worn far enough into the cornea that the cornea, which is hydrophobic, doesn't usually let water in, is letting water in. And you can see how swollen the rest of her eye is. It's making that lid kind of come away from the eye. And again, she has had systemic pain medication. That eye is painful, but we've given her our best pain meds already. You're a good girl. And looks like she also has had a cut tail tendon. You can see an obvious break right here. Oh, sorry, Mama. Her heart rate was in the 60s, and now it's about 48. So upper end of normal is kind of mid to upper 30s. So still elevated, still indicative of pain, but better than it was at least. You just got no teeth left, huh? So we've got 1, 2, 3 teeth with furcations that I can see right here. This mare just doesn't have any teeth left. That's her soft palate, and that's where her teeth are running. And you can see a furcation right there on that tooth. See how you can see these tooth roots? Hi, sweet lady.
Pizza's here. I'm gonna go get the vet's pizza. Vets like to eat up here, so they don't have to disinfect and then get reinfected with all the contagious diseases. And I'm gonna go grab their pizza. Everybody's gonna take a little break. And then after lunch, I'm going to be actually manning the Almost Live. Alrighty, so we are back from eating lunch, and we have a few horses left to go through, believe it or not. We rescued about 20. And I'm going to catch up with Tani and find out exactly how many horses did we rescue, how many do we have left? All right, so Tani, how many horses have we rescued today, and how many have we done intake on, and all that kind of stuff?
Yeah, so I'm doing a video. I'm editing a video right now. It's point of view, so it's filmed through my glasses, which is kind of cool. So there was 11 horses in the first trailer, and then the second trailer there was 9. So we have 20 horses for today. And we got through 11 before lunch, and now we've got 9. So we're going right along.
Perfect.
Just run them in. It up to you, but
I was seeing if I could fit their head.
yeah.
Alrighty, so Trey's trying to catch the next horse, and sometimes they don't come to us halter trained.
Okay, you're good.
Which one of these guys kind of panic ran out of the trailer? I'm trying to remember. You want a treat? Look. She does have a bit of a crusty neck.
How old did you say she was?
She's about 16. And she's very beautiful. She did offer to kick Trey, so just maybe. Good girl. Good girl. Behavioral issue, I don't know. But she's been great with people. She's a little towed in, like medial to lateral imbalance, but also I think a lot of that is just that she really needs to see the farrier. So, all right.
What do you think on her?
Great. I have no major concerns other than she's got some nasal discharge. She's a little bit dehydrated. She's got some hoof neglect, but her heart and lungs sounded good. We haven't seen her coughing. Her gut sounds were normal. And otherwise her physical exam was normal. Obviously this is not a lameness exam. This is a, are you dragging a leg level lameness exam, but she appears to be sound at a walk and neurologically normal, and that's great. So we're gonna get a blood sample from her and scan her for a microchip and give her some vaccines and some dewormer.
Because I don't have to
Yeah,
yet.
okay, got it.
Unless you're okay holding.
Did we get photos?
You good?
Okay. Liz, are you comfortable holding? Are you available to hold? Okay, I'm gonna go look at the next horse then. Okay, hi. Hi, big girl. Are you okay now that your friend is not with you? Hi. She's a nice, solid-looking mare. You got a scar on your cornea. What happened? Hi. Oh. Oh, you got a couple scars. That actually might be an active ulcer. You should stay in that. Okay, I'm sorry. Good girl. Okay.
So if you want to explain what you're doing while
Yeah.
you're doing it, that'd be totally fine.
Absolutely. This is called a fluorescein stain strip. It's sterile and it's designed to be put into an eye. And then if there is an ulcer present in the eye, it's going to uptake the stain. Ah, she's okay just like that. So it's a safe, easy way for us to tell the difference between a scar and an active problem. You're all right, girl.
So it's almost instant.
See
like
how
just-
it's glowy? See how that little dot is glowing? So that is an active ulcer. So it did uptake stain. See the dot right in the middle?
Yeah.
But the bigger spot over here on the side didn't take up stain, so that would be a scar. Yep.
It's no incisors day. Are you a cribber?
All right, we're gonna have to do dental rads because she doesn't look old.
No, she's body's in great condition.
Yeah. She might be a cribber. She has no incisors.
Are you a little bit worried? You're okay. Good girl. You're okay. You just need a minute.
Unfortunately, she's not halter trained, so she has to go on the squeeze chute so our vets can work with her safely.
Good girl.
Any health concerns with her?
Shocker. No, she looks great. I don't know how old she is yet.
If you want to tell me when her head's up, I can.
Okay. Let's pull blood and give her vaccines first. She's older than 3.5 and younger than 4.5, so let's call her 4. Okay. And I think I can deworm her. You got that dewormer?
This is the next horse.
Yes, it was a transfer.
She's got elevated lung sounds. Super stiff on the left front. When you palpate her neck, it's very not straight. It kind of goes like this. And it could just be chronic muscle, but she's got atrophy on this side and she has kind of a big knot on this side. I'm sorry, big girl. It feels like it's rock hard. feels like it's been like that for a long time. You're okay. Does that hurt?
We've noticed something strange with this horse. There's something extra on her leg. We don't know exactly what it is, and she won't let us get close to her. So we're going to move her over and see if we can figure out what this extra something is on her leg. I think she's got 5 hooves.
Super overgrown hooves. Holy moly.
Everybody go home and take a
Y'all hear the squeaky gates? Well, we're gonna fix it right now. Let's see what we can do.
Here we go. A nice glob of snot. Is it haired at the top? You're okay, big girl. I'm gonna try to just keep listening. Yeah, that feels like lymph node enlargement under there. Can I feel it one more time? You're making everybody's job harder. Can you pick your head up? Good girl. Wow, you know, not to condone the auction treating tricks, but they really do look younger when their manes and tails are shorter. Like, I know that this horse just got her hair cut. I think we're gonna have to just put her in the squeeze chute for the pokes.
It's wearing a halter, but doesn't know what that is for.
Just set it on the ground. Yeah, that's perfect. Probably had some patient movement there, but let's see what we got. I think we should just send this to Marina and be like, what is this? Without giving her any clinical context. I really need an orthogonal. I'm going to be pretty simple to surgically remove.
So she just has a dangling extra hook.
It's only attached to her skin. That off. No problem.
Her teeth changed with her haircut.
I can't see her. Whoa.
Got baby teeth.
You do have baby teeth. How come you got a baby and you're just a baby? It's a weird looking tooth. Yeah, 4.5.
Checking for a microchip.
These clippers also had pizza for lunch. Hi. You look a little worried. It's okay. Got a lot of those things too, huh? Connie, I'm going to try to palpate under this belly.
Yeah. I think they might be.
That's a big plaque of pitting edema.
Another horse needs your mane cut off. Just so many stickers in there.
Take them. Spend a whole lot of time and get all these stickers off. The main thing is we don't want them growing on Horse Plus property. And thinning a mane out that has stickers is not a bad thing. Now, one horse did have to lose its entire mane, but
Well, that one especially,
it was so thick.
It wasn't a trained horse.
Yeah,
so.
it was wild. And this one's pretty calm. I think we're good.
He's like, what? I know. We're stabbing you all the things. Oh, it's so bad. I like that horse. I don't know why he has edema though. He's not that old. Yeah.
So is this the last horse or?
Nope, we have one more.
One more, it's a baby.
All right, so after this horse, we have one more, and it's a little baby. This one doesn't look like it's very halter trained.
Hi. You're okay. Good girl.
Fly mask, and then we're finished. Right.
All right, this is the last horse, number 20, right here. Coming in, gonna get checked out. It's just a little baby. What an incredibly cute little baby.
It went really well, really smooth. 20 horses came through, and this is our last one. And there's a beautiful pasture out there full of horses. I saw it real quick before bringing the baby in, and it's makes your heart really happy. Sometimes buyouts are so heartbreaking, but there's a lot of horses we have to say goodbye to. But there's a beautiful field full of horses out there, so you'll have to take a look before we totally end your almost live.
Here. Yep. Wonderful.
Yeah, you got a friend right there.
Another mane full of stickers.
Yep.
Okay.
That's more than I thought I would get.
Oh no, can you move your knee back over here?
Give us just a second, just one thing we've done.
Okay.
To do to her knee.
She has a wound on the outside of her right front knee that was just really gross and crusty, and I actually was able to clip all around it. It looks like it's on its way to healing. It was already covered in granulation tissue, but the discharge that was stuck on smelled really bad. So I got all of that off, and then I put this Aquaid stuff over the area of granulation tissue. Boop. And we'll schedule her for a recheck. You're okay. I know. I need to draw blood, and I need to give a rabies vaccine on the other side. I might try a little butterfly needle with her.
All kinds of new things for this little baby today. But this little baby's not in the slaughter pipeline anymore.
Okay, I gotta poke you one more time, tiny baby. It's gonna be the worst. Okay.
Where'd all the horses go? Come on. You're a good girl. I'm thinking that that's not her mom. But, like, if that was her, hold on just a second, because she has an abscess. Let's just talk with the vets again. So, Dr. Lydia.
Yeah, you look like her. Get in there, quit trying to fool us.
But see, if that's like her baby, it should just go to nursing. But they're acting like they like each other, so that's good. Just kind of weird. That doesn't act like a mama and baby. It's most babies, if they've been separated from their mom that long, they go to nursing. And coming over here, she would have been like right on her tail. Hold their tail off to the right side, so they got to be related.
Great.
Well, today went really, really smooth. We're really thrilled to be out here in the pasture with lots of horses that came out of the buyout today. Like, I'm just like, oh.
Yeah, we had 20 horses come in. Well, some of those were donkeys. We had 20 equids come in. 5 of them were in really, really rough shape, and we had to make euthanasia calls on them. and 15 of them are turned out in various spots. And
It's a beautiful sight.
it is.
beautiful
It's really exciting getting to watch them roll and graze. And
Through the investigations that we were doing, some of the groups of horses that we got, at the end of the day, there's only 2 that we think we can save. And it's a really, really hard days, and especially for our entire team, but we weren't able to tell you, hey, we're majorly investigating the slaughter pipeline and all these horrible things that are happening with the horses and stuff. But
and also,
those horses needed
we're here
help.
for them too. That's
Yeah,
right.
they needed help.
There are not a lot of places willing to advocate for and provide those animals with what they need. So
Yeah. So
saving them either way.
great day. I can't believe it's almost December. The weather's perfect.
I know.
So awesome. Thanks for your support, your donations. Since we got done early, you're going to do the buyout debriefing,
Yes.
and that will get out there. So thanks for watching, and I hope you've enjoyed this.